Hello, everybody. We are back today with another recording of SMAC, and I've invited Tamsin Nel. Tamsin Nel is running a mass activist sterilization clinic in Khayelitsha here in Cape Town, South Africa. We are appealing today for the support and help of donors and anybody who has abundance to share towards her efforts. We are experiencing a crucial time, not just in South Africa, but across the globe. And we'd like to ask you just to spend some time with us today, listening to what Tamsin has to say and sharing our message to as many people, friends, and followers as you can, so that we can all be in this together. Thank you very much, Tamsin.
Pamela, thank you so much for inviting me onto this. So yes, my name is Tamsin Nel. I founded the SA.MAST animal clinic July 2006, and initially it was never supposed to reinvent the wheel. I thought I was just going to provide the funding and the tools to already established organizations. But there was a day experienced in Khayelitsha that changed my life forever, and a particular experience led to me establishing SA.MAST in Khayelitsha in order to initially conduct mass animal sterilizations and primary treatment. But the logical flow of that was when we were helping the Khayelitsha community to manage their animal population. They were starting, they came to us for help for sick and injured. Which then eventually led in 2015 to us building a fully equipped animal clinic and hospital. So we continued with the mass sterilizations, but we added to that to treat the sick and injured and have animal ambulances on the road 6 days a week.
I can completely resonate because I've spent so much time in India, and I can believe that what I've experienced on the streets in India are very much the same kind of circumstances that you are facing in the townships. Can you tell us the size and capacity of your operation and how your emergency services are working during this time?
So fortunately, we are veterinary field is seen as essential services, and none of my staff have been harassed when responding to emergencies. What we have is a very well cell number in Khayelitsha that people phone if they need help with a sick or injured animal. It's so well known, in fact, that we get calls from across the peninsula. This number is just getting passed from one person to the other. Half an hour ago, we had to respond to an emergency just outside of Guguletu with a dog that has been on the side of the road for more than 24 hours. So during lockdown, our animal ambulances are on the road, responding to calls from guardians or concerned neighbors, just members of the public who have observed an animal in distress.
Okay. You've got obviously some great community networks and support there, but do we still struggle with the large stray population of animals here in Cape Town?
Oh, absolutely. To give you an insight of the challenges that one faces with managing, the size of a population, an animal population. in Khayelitsha, we sterilized over 20,000 cats and dogs. We have gone from area to area and gone home to home, whether it be a low-cost house or whether it is a shack. And we conducted all the health and welfare census. With that census, we record information like whether the animals are sterilized, whether they're healthy, whether they're injured, whether they're neglected, whether they're abused. We also focus intensely on educating guardians. Sometimes the neglect is purely coming from a place of not knowing. You know, yes, for example, somebody
is ignorant in education.
Their dog pup, and thinking, no, but I'm feeding my dog. And then we go into the whole educational process. Information that comes back to Clinic HQ, and we then start scheduling the relevant activities, collectionization. Do they have a kennel? So as fast as possible, we try and build kennels for dogs that have a shelter or no shelter. And then as my team is going from door to door, shack to shack, if there is an emergency, activate the animal ambulance service. So we're feet on the ground.
Yes.
And right there online. The challenge comes in, though, Khayelitsha is growing exponentially. Just in the last years, six new areas have been added to Khayelitsha. These are previously unoccupied land. And just as we think we've achieved our 80 to 90% sterilization coverage rate, another area gets added. So our work is never done. But that being said, we have transformed large part of Khayelitsha to, when I say transform, not reducing the population, but improving the health and welfare of the animals that are already in existence.
Some balance. So
there's nothing better. There's nothing better than to visit a home that you were maybe there 6 months ago and you went through all steps in terms of improving the situation, and you come back 6 months later to just do a quick, checkup, and you see the benefits. You can see the improved situation.
Fantastic.
But all of that might come to an end.
We spoke briefly yesterday about the allocations and why you specifically request monetary donations. You spoke about the fact that the medicines get kind of spread out over. Maybe you can just go into that a little bit so that we can really impress upon people that you don't necessarily want the medicines or the food, that you have better use of the financial resources.
Okay, so there isn't a single supplier that's paying kind. The kind of what we use funding for, overwhelmingly the biggest part of our budget is paying for veterinary medicine and consumables. And when we talk about medicine, we're talking about things like morphine. We're talking about antibiotics. We're talking about bandages, suture material, treating ilichia, putting animals on drips, sedating. All of these things cost money. And it costs a lot of money. treating for ticks and fleas, which you think, oh, well, you know, that's just like primary treatment. But actually, if you don't treat for ticks and fleas, then you have an increase in tick bite fever or biliary. You have an increase in ehrlichia. So it's preventative, treating for mange, noromectin, 2-0 suture material, 1-0 suture material. All of this amounts to a very large chunk of money that we have to pay to our suppliers. If we're fixing a broken leg, you know, the pins, you know, it's over 1,000 rand for one pin, as an example. Disinfectant. It all comes together, and on any, you know, in March, I spent 60,000, over 60,000 rand on just paying suppliers, and we're buying at wholesale pricing.
Yes.
But even at wholesale pricing, what needs to be borne in mind is we are not situated in or close to the leafy suburbs. And the reason why I bring that up is that if you look at welfare organizations close to or in, you will find that over 80%, if not more, of the people that access their services are contributing towards the service or the veterinary treatment that they are receiving.
Yeah.
So it's a lot easier for them, you know, their nose above water. Whereas SA.MAST has chosen to be of service to the poorest of the poor.
Yes.
And that means that 80 to 90% of the guardians who access our services don't contribute to anything at all, but they do bring something to the table, and that is compassion. And I will take compassion over money any day of the week.
Yeah, that's a really emotional and heartfelt message. You were telling me about the the documentary that I ended up watching yesterday called Behind the Mask: Animal Liberation. And I must say, I did watch it, and I cried a lot of tears. I can't thank you enough for everything that you're doing, putting yourself right there at grassroots level, and not just helping our animals, but really helping the people that are needing that education to raise their own awareness and then their own levels of compassion. And I'm sure that that ripple outwards into the community is profound.
Can I take a moment to tell us a story that's very close to my heart? Whew, okay. In 2008, before I had built our facility in Khayelitsha, I was doing outreach work in the one-man show. And we went into an area that was a new RDP housing area. So in other words, a low-cost housing area, which is a huge upgrade from a shack environment. You know, when there's just like a sea of shacks and detritus and, you know, and it was early in the morning. It was about 7:30 in the morning, and a lot of people were awake and getting, you know, on. It was a beautiful, beautiful summer's day, blue skies. People were outside. They were excited. Some were even painting the numbers on their houses. You know, it was a brand new area. And as I was traveling down this road, getting a feel for the different kinds of areas of Khayelitsha, there was this pile of building rubble. On this pile, there was this dog, big black dog, skin and bones, utterly emaciated, mangy, a little bit mangy. And he was just lying there. And I thought the dog was dead. And I actually watched people step over it. And I went to the dog, and he was alive. Barely. And in front of this dog, people were just going about their normal business. I gave the dog some water, but the dog in my arms about an hour later. And I didn't have anything to do. I couldn't save the dog. I didn't have a clinic. I mean, I tried to get help, but, you know, it was hours and hours away. And that was the day that I decided, one, animal sterilization, because this dog should never have been born in the first place. And that if I could swing it, one day have animal ambulances on the road. But something else was the indifference of the community. And just like I, you know, had to, when I tried to phone for help and I couldn't get help, I realized that the Khayelitsha community had been exposed to this kind of thing for years. And despair eventually became indifference. It was just c'est la vie, you know, this is life, this is what it is. And I just thought, like that, to grow up as a child like that in Khayelitsha, where suffering is normal, animal suffering is normal, it's just part and parcel of your daily life, would lead to a certain kind of mentality.
It's everywhere in the world. It's everywhere in the world. People have built up these heart walls, and we have lost our connection to our environment. I attended to a dog which was being eaten alive from the inside of its neck out into its brain by maggots, because there was a small wound from when it was mating. The male dogs grab onto the back of the neck and they bite the female dog so hard that inevitably, when it's time to let go, there's an open festering wound. A few months later, the wound was so ginormous, and I still thought I could save this dog. So when I started to apply the spray to get the maggots to come out, the movement on the nerves in the brain must have just, and it, you know what, I reached out to not just the people that were around me, watching me at the time, but my closest friends, to give me the emotional support that I needed. And I still didn't get it. So I want to impress right now, for whoever is watching this, to not just open their hearts, but there's a mind, body, soul connection that has to start happening. And when we talk about the fact that we're all losing sleep right now, there's something happening on this earth that is resonating with us on such a deep level. And we are feeling these activations within the body and the soul on a very deep level. We have to be so mindful of our connection to our environment and Mother Earth and the animals that have been put there. The earth is theirs first. We are guardians of this earth. Thank you for everything that you do.
Thank you for reaching out. We're taking it one day at a time right now.
Tamsin, please let everybody know where they can find you online, what your banking details for donations are. If anyone can contact you after this crisis is over for any other assistance like volunteering, please let us know what we can do.
I think the easiest way to go about it is go onto our website, which is www.SA.MAST, so that's SAMAST.ca. To contact me, all my contact information is there, even my cell number is there. Our bank account is there, my email address is there. And really, no matter where you are in the world, our site is set up so that if you're in a position to, and only if you're in a position to, if you would like to contribute towards our costs, you can make a donation. And if you just want to offer some moral support, that would be great too.
Very briefly, you have a dog you mentioned that is currently confined in your clinic that you are looking for a home for.
Yes, I'm going to try and do this. One second, please.
No problem.
Do
you have a name for the dog?
No, I don't. And there's a reason why. I don't name the name. I'm tickets. I'm done for. They're needless to say. I'm not sure if this is going to. Can
yes, put it right up.
See that?
Put it right up there. Okay, wonderful.
Okay, so
I'm going to ask you to. I'm going to ask you to send that picture to me. We'll include it.
He's a collie cross, who is being neutered today, and he's a perfectly normal, sweet little wolf. He's desperate to get out of the kennels. He got stuck in there just as lockdown happened. I managed to get all my other out. But yeah, I couldn't get him out. He's approximately 2 years old. Bearing in mind he is a collie, so he needs to run. He needs to run. He needs to go to a home where he will get sufficient amount of exercise every day.
For this,
he's very clever.
For this fostering or to get the dog rehomed, would you then go and see the people interested and actually deliver the dog to that home?
No. Let me explain how our shelter works. The shelter was built towards the end of last year. Bearing in mind, we are in Khayelitsha, where very few people want to go to, despite the fact that 1/3 of the peninsula's population lives there. Very few people from the leafy suburbs will travel into Khayelitsha.
Yes.
So we always knew that building this shelter was not going to become a rehoming center. It was going to become an emergency shelter. And that was so that I wouldn't have abandoned or hopeless, abandoned or surrendered animals sitting in hospital cages, which is not an environment suitable. But it was so that we could, instead of having like 48 hours of trying to find a dog to go to, it was to give us 2 weeks. So what we are trying to do is network with professional rehoming organizations. or with fosters who take on the responsibility of finding a suitable home. We don't charge any kind of fee at all. We take full responsibility for all vet-related costs, vaccination, sterilization, parasite treatment, anything that's related within the first few weeks of any cat or dog being fostered or adopted. And then we offer support to parents, but the foster parents themselves will go and do the home checks, and they will do the screening, and they will do the networking. And that's not because we don't want to, it's because we just don't have the human resources to do this. We don't have any to pay people to be on staff to become an adoptions officer.
No, it's a massive
So
operation
that's how,
with a lot of administration. Yeah.
And so far it's been working well, but this poor boy, you know, he was left behind with the lockdown. Can I show you another photo?
Yes.
So that's JJ.
Come a bit closer. Come a bit closer. Yes, down a little bit. There we go. Yes.
Okay, so that's JJ. He was on animal ambulance run yesterday.
Okay.
He had just come in with that patient yesterday. So then we've had the dogs that are by the police. Fifi and Fido are doing well. Their recovery is going really well. Psychologically, it will take time for them to recover, but physically they're doing well and they're back with their guardians.
Okay. Tamsin, I think let's close our session today. Please take care of yourself. You're working very, very hard around the clock. And I'm going to ask you to send those photographs to me so that I can include them in all our marketing as I share these videos out to our communities. And let's see what happens from here. Is there anything else you'd like to say before we close?
Please help.
All right. Thank you, everybody.
Okay, bye.